International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Colleagues, ladies and gentlemen, it is a pleasure to introduce a collection of paper focusing on one of the most important areas of health system strengthening worldwide and also in Pakistan. So the government of Pakistan is committed to achieving the SDG target of universal health coverage, or UHC. And in this regard, in 2018, the government established a national initiative to set an evidence-informed, affordable, and feasibly implemented package of essential health services to achieve UHC through a primary healthcare approach. And this supplement describes the methods and the processes adopted by the government to prioritize health services. And this collection of paper, which I am now introducing in this very short video, actually presents the experience of Pakistan. It reviews the decision-making processes that were adopted. It presents the lessons learned and also the challenges ahead, with a special focus on the requirements for the transition from package design into effective implementation and nationwide rollout. But let me first explain why this subject is an important area of research. It's an important area of implementation science. We know that 8 years after the endorsement of the UHC target in 2015, the world is still off track in making significant progress. And although there is global commitment, there was a high-level meeting organized by the United Nations General Assembly in 2019, and the heads of states and government in this meeting actually reaffirmed their commitment to UHC. There was also a similar meeting with a similar outcome in September 2023. But despite these initiatives, it is clear that we still have alarming signals. Now, if you look at the global monitoring tools that are adopted to track UHC, you will see that around 4.5 billion people in 2021 were not fully covered by essential health services, and over 1 billion experienced catastrophic spending. So that is why it is essential to review the experience of countries, particularly those with limited resources, their experience in prioritizing and implementing essential health services. And that is why it is critical to identify the key barriers and the lessons learned in order to address the challenges that impede health system strengthening and also hinder a more positive response or progress to universal health coverage. This supplement has an editorial and 5 papers, and these papers are shown in this table. The focus, as you will see, is on methodologies, on processes, on outcomes, particularly in the areas of priority setting, evidence-informed deliberation, assessing and using evidence in decision-making, and selection of essential health services together with costing. And the papers actually conclude that evidence-informed deliberative processes can be effectively applied in low and lower middle-income countries to design affordable packages of services. And they do represent good value for money and address a major part of the disease burden. On challenges, the papers conclude that the transition to implementation requires, number one, a comprehensive assessment and management of the existing health system gaps. 2, strong engagement of the planning and financing sectors as early as possible in the design process. 3, serious involvement of the key stakeholders, national stakeholders, including the private health sector. And finally, the institutionalization of technical and managerial skills within the health authorities, within the ministries of health. And Pakistan experience actually highlights the need for updating the evidence and the model packages of the third edition of the disease control priorities. The design of the Pakistan package was actually guided by the DCP3, which was actually published by the World Bank in 2018. So my final point is to highlight the critical need for capacity building in low and lower middle income countries. This is one of the key conclusions of this collection of paper. And I think it's very important also that we highlight another equally important conclusion of the paper, and this is a call for the international community, for international institutions, technical institutions, for development partners, for donors to expand and reinforce technical collaboration to support these countries in UHC reforms. Thank you.